Hello everyone, my name is Andrea Ruiz and I chose to do my body systems project over the metabolic system. I will be explaining what this system is and the changes that elderly people experience in relation to this system. So first of all, we're going to explain what the metabolic system is. The metabolic system is responsible for all the chemical reactions that are important in powering our bodies with the energy they are needing to get us through our daily activities. These chemical processes occur throughout the entire body and affect every system. The most common idea that comes to mind to people when they think of the metabolic system is its relationship with our digestive system and how it breaks down food in our body to supply us with nutrients and energy. However, it is much more complex than just that aspect of metabolism. For example, the endocrine system deals with a number of hormones released throughout our bodies, which in turn plays a big role on the metabolic process and affects many of our organs. When speaking in terms of medications, however, Tui and Jett explained that metabolism allows the body to modify chemical structure of our hormones and the drugs that we take in so that they can be used in a therapeutic manner. Now we're going to talk about changes in the geriatric population. First, we're going to talk about the liver. The liver plays a huge role in the metabolic system. When a patient gets older, the liver reduces in activity, mass, blood flow, and hepatic clearance. In an article written by Tahiri and Shimizu, they claimed that the volume of the liver is reduced by 20 to 40%, and the blood flow is estimated to decrease by 35 to 50% in the elderly population. These physiological changes reduce the liver's ability to function properly. The liver is responsible in detoxifying chemicals in the body and metabolizing drugs. When the liver function starts to diminish, it alters the ability to metabolize the medications these patients are taking and alters how we process the chemicals that are being released in our bodies. The next thing I want to mention is the changes in body composition. These occur as a result in metabolic changes. As the person ages, they tend to develop more fat composition, which typically accumulates around the stomach. So, the waist circumference and the amount of cholesterol both increase. This is not something that we look forward to, however, it does happen, and this is due to the fact that the resting metabolic rate decreases. The resting metabolic rate refers to the calories that your body burns while you are going about your normal day-to-day activities. So, the amount of calories that the patient burns in a day at the age of 60 is not quite as high as the amount that they burned when they were more physically active and in their 20s. However, when you remain consuming the same amount of calories that you consumed way back when, then your body begins to store what is left over. Now I want to go on to talk about the pathophysiology related to different disorders that are affected by the metabolic system. And first I'm going to start off with diabetes, which is a part of a disorder relating to glucose metabolism. This can result from insulin resistance, absence of insulin, or if the patient has been on chronic steroid use and developed steroid-induced diabetes. Complications related to this metabolic problem are stated by Kathleen Jett and include heart disease, stroke, neuropathy, and periodontal disease. Nerve and vascular damage can occur with diabetes, and because of this, the renal vessels may become damaged as well. When these renal vessels become damaged, they alter the rate at which the kidneys can excrete waste from the body. Some common risk factors for diabetes include obesity, sedentary lifestyles, and poor diets that are high in sugars and fats. In the gerontology book, written by Tui and Jett, they explained that for unknown reasons, the tissues in our body, over time, begin to develop a decrease in sensitivity to insulin, which results in type 2 diabetes mellitus. Type 2 diabetes mellitus is the most common form of diabetes in elderly patients. Now we are going to move on and talk about the thyroid. The thyroid is a small organ in the neck which excretes hormones and these hormones help regulate metabolism. Kathleen Jett stated that signs such as a decline in cognitive function or functional status or even irregular heartbeats may be incorrectly attributed to normal aging, another disorder, or the side effects of medications, when in all actuality, it's the thyroid. The two common disorders relating to the thyroid is hyper and hypothyroidism. Hyperthyroidism is when there's an overproduction of thyroid hormone thyroxine. The excessive amount of thyroxine increases the metabolic processes in our body, which speed up all of our systems. Some symptoms that occur with hyperthyroidism include atrial fibrillation, palpitations, weight loss, protrusion of the eyes, nervousness, tremors, and heat intolerances. Hyperthyroidism can be treated with an oral medication called propylthiouracil as long as it's taken daily. Hypothyroidism is the opposite of hyperthyroidism. So there is a deficiency in thyroxine, which slows down the metabolic rates. Some signs and symptoms that can occur with this disorder include weight gain, cold intolerances, slow thinking, palpitations, gait disturbances, and fatigue. Since the cause of this is simply the lack of the hormone thyroxine, the fix turns out to be pretty simple as well. Just give the patient thyroxine. This is given in an oral medication as well, and it is called levothyroxine, which also needs to be taken daily. Now, when you are performing an assessment on a geriatric patient, it is important to look at different areas that are affected by metabolic changes. There are many factors that can be evaluated. Metabolic factors can be expressed by insulin resistance, hypertension, and cholesterol abnormalities. Medical author and doctor Melissa Stoppler also explained that many metabolic disorders have been associated with cardiovascular disease and cardiovascular assessments. So it is important to conduct these assessments on these patients. You want to assess for any irregular heartbeats along with palpitations. And for the vascular assessment, it's important to check cap refill along with any signs of edema. Assessment data will be geared towards the disorders that can occur due to metabolic complications. So first thing we want to look out for is weight changes. This is an important factor to assess mainly because it is a key sign that there are alterations in the patient's metabolism. In order to provide an accurate assessment, the patient must be weighed at the same time every morning of every day in the same clothes, and make sure that the patient has voided beforehand. Another assessment that should be done is testing glucose to make sure that the patient's fasting glucose and their A1C are in normal ranges. If there are any fluctuations, this could be a precursor for diabetes. This can help screen for diabetes, and some of the cardinal signs that relate to diabetes include polyuria, polydipsia, and polyphagia. Now, when educating these patients, you want to make sure that they are aware of the signs and symptoms for thyroid problems and for diabetes. So as stated before, with the thyroid problems, you're going to have the weight changes, the heat and cold intolerances, and stuff like that. And with diabetes, the cardinal signs for diabetes is polyuria, polydipsia, and polyphagia. You also want to make sure that these patients are maintaining a healthy diet. You're wanting to make sure that their diet is low in fats and low in sugars to help prevent weight gain and excessive amounts of calorie intakes. Next, you're going to want them to know the signs of cardiovascular issues. These can include swelling in the extremities or poor blood flow to their extremities as well. It can include heart palpitations, tremors, and high blood pressure as well. And now you're going to want to make sure that they stop smoking if they are heavy smokers. This is because smoking can cause damage to many of the vital organs that are needed to carry out our metabolic processes. daily. I want to thank you all for listening to my presentation, and I hope you learned something important from this video. And to end it off, I am posting my Works Cited page, which has the 4 sources I used to make this video. Thank you.